So good afternoon, and firstly just to say thank you very much to Investnet for inviting me to join this really exciting summit that's been ongoing today. So thank you very much. I'm going to talk to you this afternoon about how we can leverage the power of telemedicine to improve diagnostic quality and capacity. And as you've heard today, a number of talks around the impact of the pandemic on healthcare services, certainly one that's very relevant to that topic as well. So I'm going to start by talking about, first of all, who are Medica? And we've entered the market into Ireland last year, so Medica may be a company that's fairly new to a number of you. I'll then talk a little bit about what is teleradiology, some of the drivers of teleradiology, and then what the impact of the pandemic has had on healthcare. And as we've heard a lot today, that won't surprise you that it's had a major impact on the teleradiology side as well, and then some of the benefits of this service. So starting off, Medica has been around for about 15 years. We listed on the London Stock Exchange in 2017. We're on the main market in London. We have a market cap of around 190 million pounds. Across the world, we employ over 300 employees. And really importantly, we have a network of over 750 specialist radiologists, doctors, and radiographers who we work with on a contracted basis. Medica has active in 4 geographies. We've been in the UK for, as I said, 15 years, and our focus there is on teleradiology, which I'll talk a bit more about in a second. We have over 500 radiologists, and in 2019 delivered over 1.5 million reports for the National Health Service. I'll talk about Ireland in a second. That's the focus of the talk today. But also we're present in the United States, where we recently acquired RadMD, which is a business that has specialist imaging services for the clinical trials market. So very exciting business that we've acquired recently. And then finally, we also entered into a joint venture this year with a business called Integral Diagnostics in Australia and New Zealand. And we're going to be using that partnership both to improve the capacity that we can offer in terms of radiologists who are both IMC, Irish Medical Council, and GMC, General Medical Council, qualified in the UK as well as the opportunity to enter the Australian, New Zealand market, and in time into other international markets. So focusing on Ireland, so many of you may know the business Global Diagnostics, which is the business we acquired back in October last year from Centric Health. And Global's been helping the HSE now for the last 13 years with provision of radiology services. And we're Ireland's only national teleradiology provider. We're very proud to work in 24 HSE hospitals across Ireland, and we're present in all the 7 hospital groups. We provide a range of services from equipment, such as X-ray, ultrasound. We also provide staffing with radiographers and sonographers, and we provide increasingly a reporting of images remotely using a network of radiologists who are Irish Medical Council certified. And I'll talk a bit more about how teleradiology works in a second. We have over 24 radiologists working in Republic of Ireland, but also 17 in the UK who have trained in Ireland, are IMC registered, and also we can use to increase the capacity of radiologists that we have. Last year we reported over 200,000 exams in Ireland. That's increasing rapidly, and we're very proud to be partnering with the VHI and the HSC. We're present in 37 different clinical locations. That's our teleradiology business. We also provide ophthalmology services, and we work to provide diabetic retinopathy screenings in Leinster, which is about half of the population of diabetic retinopathy screening across Ireland. And again, that's a remote service where patients have images of the back of the eye taken all across Leinster, and then we report those centrally using a team of very highly skilled ophthalmologists. So what is teleradiology? So we define this as the transmission of patient images such as X-ray, CT, MRI scan from one location to another for the purpose of interpreting and reporting these images. And really what happens is you've got either the patient is referred by a referring clinician for a scan, or increasingly they can use the network of radiologists that we have at Medica to refer those patients for scanning. The scanning is taken locally, wherever the hospital is across Ireland, and then those images are transmitted centrally, and we then pass those images out to our network of radiologists who report them from their home using a workstation that's provided by Medica. The reports then are delivered back into the system of the hospital. Now, in the UK, where we've been providing the service for some time, we are able to get emergency scans for things like stroke, heart attack, etc., back into the system within an average of around 24 minutes. So it's a very fast turnaround service that's provided remotely across the country. What are some of the drivers of teleradiology? Well, won't surprise you that with the increasing pressure on the healthcare system, that there are increasing numbers of patients requiring imaging to diagnose their condition, particularly in areas like CT and MRI, where we're seeing about a 10% increase in activity annually. What's also driving this now is that we're seeing an increasing number of patients attending out of hours and requiring imaging, and also the pathways that the HSE and in the UK the NHS are putting in place to manage, for example, in Ireland, the fast positive stroke pathway is again leading to more imaging done out of hours and putting a real pressure on radiologists to provide that support. And that's at a time when we're seeing not only the demand increasing, but on the capacity side, we're seeing a shortfall around 38% of radiologists in Ireland. And that's based on there being 5 radiologists per 100,000 population in Ireland versus a European average of 8. And England's not much better with only 6 per 100,000. So there is a real shortage of radiologists. There's also increasing complexity of studies, which means that it's taking longer to report individual studies because you've got more complex modalities like CT and MRI. And also, there's more of a trend to need subspecialist radiologists. So not every radiologist can report every study. And certainly at Medica, we have a very subspecialized approach where you need neuroradiologists to provide reporting for brain scans, for example. You need musculoskeletal radiologists to look at, for example, fractures. So the subspecialist is also making sure you have the right radiologist present at the right place at the right time. And that's why teleradiology can really help with providing support. And clearly, there's a huge pressure here where, particularly in Ireland, you're seeing radiologists having to work through the daytime and then go on to an on-call shift at night. So they're being woken up during the nighttime to report on urgent cases. Now, in the UK, we've moved away from that model for many years now, and the majority now of the out-of-hours provision is provided by teleradiology companies who have radiologists sitting there working through the nighttime, subspecialists, and they can provide really fast reporting rather than having to pull a radiologist out of bed to report an urgent shift. I'll talk a bit more about that, but that's a huge opportunity in the Irish market. So moving on, this is the big scary numbers slide, and you've heard a number of people talk about the impact of the pandemic. So I'm not going to dwell on this too much, but looking at HSE data, about 500,000 fewer outpatient appointments in 2020 when compared with the previous year, and about 1 million appointments have been cancelled in 2020 and 21. Those are not patients many of those are not going away. They're long-term conditions that need to be dealt with, and that's leading to a huge backlog of patients. In England, of course, we're seeing the similar thing. We're seeing the longest waiting list since records began, about 4.7 million patients now waiting for hospital treatment. And really, really sadly, within that, we know that there are a lot of patients who require treatment for cancer. We saw 8% reduction in referrals for cancer last year. And so we know within that population that we have there will be a lot of patients who have not been diagnosed in the last couple of years for cancer. And that's really serious. Also, we saw during the beginning of the pandemic a reduction in patients going to A&E with symptoms for stroke, heart attack, which again is really scary because patients made the decision not to admit because of the potential of catching COVID. And so again, that will exacerbate the impact on healthcare. So really, we're in a situation at the moment where we're seeing a sort of perfect storm. So we've got the increase in demand prior to the pandemic, we've got this huge backlog, and then we've got the shortage of capacity. And I think telemedicine can have a massive impact on helping us as we recover from the pandemic. So in the terms of teleradiology, we see certainly it can help to access a wider network of subspecialist reporters. We can help to provide additional capacity to get back to some sort of normality in terms of the waiting lists by utilising not only the radiologists working in the HSE, but this network of teleradiologists to provide additional support to get through the backlog. But really exciting, I think this is a massive opportunity for Ireland, is to look at how we change how the out-of-hours radiology reporting is provided. And rather than waking radiologists up in the middle of the night, we can use these networks of teleradiologists across Ireland that we have at Medica to really provide an out-of-hours support that allows us to focus on getting the reports back as soon as possible. It allows us to use tools like AI, which I will talk about in a minute, and then really importantly allows this subspecialty reporting to get the results back as quickly as possible. So what are some of the benefits for hospitals? Well, clearly, it allows hospitals to match their own capacity of radiologists with an external capacity and to be able to flex that as required. It allows you to rapidly adopt best practice pathways for areas like stroke, for trauma, across a network of hospitals. So you can roll that out because you know that all the radiologists are reporting according to the guidelines and protocols that you have set as a hospital. Clearly, it's attractive. It allows you to attract radiologists because if you're not forcing them to do on-call, I think that's a more attractive proposition for radiologists. And we've seen that in the UK over the last 5 to 10 years now with very, very few radiologists doing any on-call whatsoever. We've rolled out AI as part of what we're doing in the UK, and we will look at doing that in Ireland as well. And we've done over 50,000 cases. And if you speak to our radiologists, they will admit that there are some cases where, for example, here, what you can see is an intracranial hemorrhage. Some of those are really difficult to spot, where it's very sort of minor hemorrhage. AI picks those up with over 99% sensitivity with our partnership with Cure AI. And that helps radiologists to improve the quality. And they have the AI alongside the primary image, and that helps them to make a really high quality report. As I said, very fast. Our turnaround times are around 23 minutes. And also we audit the work that we do. So we're picking up any discrepancies. We're also helping with positive feedback to radiologists in terms of how they're reporting, which is really welcomed both by our clients and also by our radiologists. So those are some rules. I mentioned some of the benefits of radiologists again, but it helps radiologists to help to train and develop their careers, because if you report for Medica, you can spend an evening working through some specialist reporting. If you're a neuroradiologist, you can focus on reporting of brain scans. If you're a musculoskeletal radiologist, you can look at orthopedic work. So that helps to develop your specialties. It's flexible work, it's diversification of what you're doing. And I think it's, certainly we're seeing in the UK a real increase in radiologists, particularly through the pandemic, who want to work remotely. They want interesting work to go alongside their work that they're doing in their day jobs in the HSE. So in terms of key takeaways, what would I say? I think COVID's obviously increased the pressure on radiology services. We don't see any let up in this going forward. There is increasingly becoming an unsustainable pressure on radiologists. We have too few, more work, and this out of hours issue we absolutely need to get on top of to allow radiologists to work out of hours in a planned way, in the way that we do with teleradiology and Medica, to allow radiologists working in the HSE not to have to do the on-call shifts. And I think that's the massive opportunity for Ireland. That's something we want to work with our partners in the HSE to roll out these protocols and to provide more support for out of hours. And we all know that there are examples where patients have attended during the night time in Ireland, have not got the type of referral that they probably need to diagnose the case, and that has led to some high profile cases. I think teleradiology can help to really support and drive forward improved quality and faster turnaround times for those really urgent cases. So thank you very much for listening, and look forward to joining in the panel in a second.